Hi, I'm Dr. David Russ, chiropractor and neuromuscular therapist in Portland, Oregon. And Deidre has been kind enough to volunteer to be on video with us today so that I can demonstrate a treatment for a lumbar disc degeneration. And Deidre has an L4, L5 lumbar degeneration that is somewhat advanced, and it does cause her problems. She gets pain in the lower back and hips. Sometimes it extends down the legs, down the front or the side of the legs. So our treatment today is full spine, and we also treat the legs a little bit. And we have to do this about once every 2 weeks or so. With her lifestyle and the things that she likes to do, that's how we keep the pain at a minimum. So to start with, I've got a little oil on my hands and on her back, and I'm just really gently starting with some muscle work around her lumbar paraspinal muscles. As you can see, I'm not going in very deep, I'm not pressing very hard, and I'm moving pretty slowly. Just to get things warmed up and get the circulation starting to move. We like these muscles to be relaxed before we try to make any corrective work. That pressure okay, Deidre?
Yes.
Thanks. Some people like to ask me why I always put a towel in the patient's waistband, and that's to keep the oil off their pants. I don't want any dry cleaning bills showing up in the mail. So we can identify the level of L4 here. Here's the top of her sacrum. There's L5. There's L4. And so the disc in question is going to be right in front of my fingers here, but way deep in the front of her spine. And the main part of the treatment is traction, where we want to take L4 and 5 and separate them from each other to stretch the disc and the ligaments and little tiny muscles that are around that disc. But before we do any traction, we want to make sure that hips are mobile and the lower back is mobile. So I'm just going to work my way down here through the hips. She just got treated 5 days ago, so there's going to be a little bit less to do than normal today. But here on the left side, I'm feeling some tightness is starting to creep back in. And so here, along her hamstring and her IT band, these two muscles and tendons like to sort of get together and have a party and be all bunched up together. So we want to keep them separate in their own spaces and moving in their own directions. What I can do is get a hold of her IT band in my hand here and stretch the hamstring really very, very gently alongside it, and we can get some movement in between them. It's very, very simple. Since the IT band attaches to the tibia, it kind of continues as the peroneus longus muscle, so we're just going to bring that mobilization down and finish that line all the way down to her ankle. It helps. Even though I didn't feel as much on the right side, I'm going to work the right side too. So I don't want to leave it out. Now we're ready to do some traction. So we got a handle on the table, and with my foot pedal I'll get some traction going, and I'm going to feel that traction as it's happening. And I can feel when the tissues start to reach their stretching point, right about there. Right about there. And we can get some side-to-side movement going here. It's just gentle. Each lumbar vertebra has 3 to 5 degrees of movement in relation to the one below. Not very much. So there's no need to crank these vertebrae in order to get them to move. So with my left thumb, I've sort of hooked onto that L4 vertebra, and with my right hand you can see I'm giving just a really gentle pumping action. And I can feel things starting to move and loosen up under my thumb. And if I feel a little more tightness on the left, I can open up that left side a little more. So we're moving blood, we're moving lymph, stretching muscle, stretching ligament and tendon. Very, very small ligaments and tendons between the vertebrae. And you can do this on a disc that's very recently been injured. You can do this on a hot disc. It doesn't hurt, it feels good. But if the disc is really acute and painful, I will tell the person that when we're done and they stand up, it may hurt a little bit when they put their weight back on that disc. But in Deidre's case, I don't think that's going to happen. Now with my right hand, as I feel up her spine, I'm looking for areas of restriction, fixation, and I know she had a pretty good treatment just a few days ago, so I'm not feeling much, but a little bit here on the left shoulder, coming up this way. So we're just going to really gently work our way through this and help to open it up and keep it moving. It's just simple. It doesn't have to be dramatic in order to be effective. Sometimes I like to get a hold of the patient's arm between my knees and kind of use it as a lever to get that shoulder blade moving like this here. And follow that. Get that movement going all the way down the arm. Careful not to grab too tight. This is more of a stretch. Not quite as tight on this side. Still feeling right here around T7 that it's a little tight and pulling up toward the right. So we're going to gently push it a little farther in that direction and see if I can identify where the pull is coming from. And it's coming from in here somewhere. So we're going to do an induction where I'm going to move the vertebra in the direction I want it to go. And I'm going to help it by bringing this rib along with it. This feels like rib 6 on the left side. It's just a gentle pull. Safe for any age or any condition. There's no worries about hurting people when you do that. So that's how we treat these mild to moderate lumbar disc degenerations. We see these every day. They're really common. Thanks for your help, Deidre.
You're welcome.
Thanks for watching.